guys. Yes.
This
Did you
meeting is
record
being
this?
recorded.
No worries yet, everybody. Gonna give it just like, I don't know, 30-ish more seconds, and then we'll start. But I'm so glad everyone could join. This is looking well. Wow, so many wonderful people here. This is great. All right. You know what? I feel like we've given it time. I'll keep an eye on uh, the virtual door. Everybody, thank you so much for joining us. I'm so excited about this. I know elder care is a really cool, hot topic for us to dive into. I'm so glad Sarah could join us to talk about it. She needs truly no introduction. I think so many people know Sarah, so I will just throw it over to her. This is being recorded, so as long as you have signed up, I will. This recording will be sent to you afterwards. But yeah, Sarah, thank you so much for doing this. Let me pass it to you.
Oh, thanks, Danny, for having me. And it's so nice to see some friendly faces and meet new faces. So, welcome to the latest thing I've been working on for about a year, and I think this is going to be what I work on for a lot of time to come because it has a special place in my heart. So, what I would like folks to do is put in the chat if elder companion, even elder care, and when we say care, that usually connotates home care. I know there's a few nanny agencies I've talked to, in particular, Mom's Best Friend, where they're completely licensed as a home care agency, right? So if you have considered companion or home care, um, ever, can you put a 1 in the chat if you've ever considered it? Maybe put a number 2 if you're already doing it, already doing some sign of companion, elder helper. I've heard a lot of different names, senior helper. And then in the chat, you can just say, no, it's not my thing. I'm just here to listen at all. So we kind of get a sense of where folks are. And I'll ask Danny to report on that in a minute. So my goal today is for you to know what companion care in particular is and is not. So that's my number one goal, is that you walk away knowing what those boundaries and parameters are of being a companion, a non-personal care, non-medical care, elder support person. I want you to know, what does companion care even mean? And then you can be able to separate that from what home care and the other kinds of elder care are: nursing care, CNA, personal care, etc. So I want you to really know that line. And also, I want you to move the needle somewhere on your thinking around your agency and how companion care in particular today might fit into that. If you're a maybe, do you get closer to a yes or you get closer to no? If you're already doing it, are there things you might learn today that can help enhance what you're already doing in your agency? So those are the 2 things I hope you walk away with, and we can go ahead and get started. So your current families are aging. I know many of you have owned agencies for decades, many years. So these parents that you've served on the childcare end now have aging parents. They are there. They're in your Rolodex. They're in your email list. Millions of older adults want to remain at home. Many want to age in place. There are many booming aging in place programs right now developing through Medicare, Medicaid, obviously in the private sector. But they don't need necessarily skilled medical care. They need companionship. They need social support. They need to address loneliness, which is so rampant among the older population aging. Nanny agencies already know how to recruit and screen, thoughtfully match. I learned that over the years. I've been trying and testing and pivoting in the space. So what if some of those same strengths could serve another generation? I'm not sure if you know, but by 2030, 20% of Americans will be over 65. And as the entire baby boom generation reaches retirement age, we're going to hit what is called a silver tsunami. There's going to be an overwhelming need for helping folks age in place um, in the very near future that not everyone is paying attention to. And I think nanny agencies have a role in this, right? The US older adult population grew 13% in 4 years, while the number of children declined. So people are having less children, but our aging population is mushrooming. Do you see where I'm going with this? In several states, adults over 65, they're going to outnumber children altogether. And that number continues to grow. And I probably should have put some market estimation, but this is a multi-billion-dollar market that is really still sort of not very tech and not well optimized yet to meet the crisis coming its way. So I thought of a novel solution. Many of you know I built B2B SaaS software through Book Lily last year. Before that, I developed online courses. I've always been very intrigued in this space, and I'll tell you why a few slides down. But the important part is that elders who want to age in place can benefit from the nanny agency referral. And we're going to really focus on referral, not W-2 model for today, as a solution to help address some of these needs. So thinking about how agencies can play a role, I quoted APNA in terms of how we can all access APNA for these caregiver screening and vetting methods that impart impeccable high quality standards in the in-home care community. We can look to APNA and things we're already doing in terms of our referral practices and consider honing these, bringing these over into a new space. So there's some things you know, and some things yet to learn if you want to just get into elder companion care. So a little bit about me. I started my career out as a nurse. I'm still a registered nurse in the Northeast. I did public health research for many years. Like I said, I founded that really special B2B SaaS tool last year and moved on to a direct-to-consumer tool called CareCal, which also plays a role in the Lilly Companion Program that is NIH funded through the National Institute of Aging to help this elder companion workforce grow. And we are looking to agencies to do this. So I'm currently working with a handful of agencies, helping them queue up their elder companion arms. And we have had a couple of successful placements, which is great to meet our grant goals. A little bit about me. So back to you. You can certainly build elder companion arms on your own with some of this information, with legal, etc. So I want to give you some of those tools as you're thinking about, is this really for me? And as you're really understanding what companions do and don't do. Okay. So what does it mean to be an elder companion? It's not personal. And by personal care, the easiest way to think of it is hands-on care, right? Newborn care specialists, they're doing hands-on care all the time. That is personal care. In the elder domain, it's anytime you're helping someone assist walk, even if you're guiding, you're touching their arm, helping them walk. You're helping them with medical tasks, right? That is personal and medical care, right? So personal care, anytime if you're helping someone bathe, I mean, I hate to say it, but even if you're braiding someone's hair, that is personal care. Other examples of personal care, I think really just think, is it hands-on? Am I touching the client or I'm not? That is the easiest way to think of it. Now, medical tasks can be part of personal care, right? You're doing a blood pressure, you're drawing up medicine. That is not companion care. You're even charting out their medicines. That's medical care. Companion support is not helping folks with their activities of daily living. So you're probably thinking ahead to your intake process potentially here. So when you're intaking potential elder clients, their durable power of attorneys, their children who are helping them apply, it's safest if you're just starting out to screen older adults who can perform their activities of daily living independently. What is that? That's a nursing term. Activities of daily living are, can I eat on my own? Can I bathe on my own? Can I walk on my own? Can I dress myself on my own? All of those things must be able to be done independently so that a companion's not in a situation where they're putting hands-on personal care. You want to stay out of that domain for a few reasons. The main one is in most states, and you have to check all of this through your state um, public health departments, whatever health regulatory home health agency governs your state. And I've looked at several of them with some of our my early customers, the agencies who are building elder care arms with my consultation. You really have to look state by state at what this means for you and how to stay out of home care licensing's territory. Because again, we're talking today about companion care only, which is non-medical, non-personal care, referral only. And in most cases, and in most states, that will keep you out of licensing territory. But do not quote me on that. Check your state. So we've had to dig in several states to prove that that is true. And you often want a paper trail, likely from a health department, to support that. So that is what companion care is not. Okay, quiz at the end, right? And then I want to actually talk to you. I hope to not talk too long through slides. It's a little better if we can engage. But I want to tell you what companion care is. And listen, as a nurse, I was a companion a few years ago here in Newport, Rhode Island, for a lady who lived on the lovely kind of Ocean Drive. And it was some of the most meaningful caregiving work I've ever done. Companion work meant so much to me. It was not hands-on. We did collages together. The clients got to know me as the collage lady. Now, she had a little more advanced dementia, and given my background in nursing, I was a little more well positioned to help her. But for new companions, you're starting a new service, you might want to screen for minimal memory loss, right? Minimal needs with ADLs, minimal medical conditions, really focusing on what companions can provide, which is enormous. They can provide presence, conversation, emotional intelligence, reliability. Are these characteristics sounding familiar among your nanny population that you know and you've matched before? Patience, curiosity, encouraging independence, observing subtle changes, building trust, all of those great environmental household tasks that just uplift everyone to have an extra set of hands, not deep cleaning. It's the same as the nanny industry, none of that, but tidying, organizing, helping organize a garage, putting clothes in baskets for giveaway, reminders to take medications, reminders about doctor appointments, but nothing more than a reminder. Okay. Driving to activities. Some agencies are okay with this, some are not. I think it sort of falls into sort of how you treat babysitting and driving and nannying already in your agency. It's something we can explore further. And then communicating not only with the elder client, but their children, durable power of attorneys, next of kin, etc. So that's what it means to be an elder companion. And they're not completely different from great nannies. They're caregivers whose strengths have applied to all stages of life, right? So in general, how is companion care different than childcare? Okay, you might already have some ideas. There's more similarities than you think. I think nannies are attuned to household environments, respectfulness, leaving the house as you found it. Nannies believe in growth and development, big time for kids. And guess who doesn't value growth and development for elders? Most of the US. We don't value that elders have the capacity to learn and grow. And I believe nannies are the best people to advocate for this because they do it with kids all the time. When I was developing our engagement library of activities for elders, we have 100 research-backed engagement activities in our app and in the hard copy. I found very little to put together for adults. How many books and volumes of information do we have? And I referenced Ani Kids, right? They do it in their beautiful app. And I told Annie, I'm kind of doing Ani Kids or not Ani, sorry, not Ani. What's it called? Raise Kids, right? So I referenced her and I said, I'm kind of doing Raise Kids for elders. So she was really helpful. Anyway, elders typically have different health needs. That's very different, right? So inside my course, I really do go over memory issues, ADL completion, chronic diseases, the typical ones we see, long-term management. You could have an elder who can absolutely complete their ADLs, minimal memory loss, and they're managing their diabetes, they're managing their cardiovascular health, right? They're managing their GI. They still have multiple appointments for a myriad of chronic diseases that definitely warrant some learning and education around. So that is something where nannies could certainly upskill if they don't already have that skill. Companion care works at a little slower pace. You're not running around playgrounds as much. You're present, you're attuned, you're letting the elder guide as an adult who has dignity, who should be respected, right? So it's less, there's nothing really about disciplinarian, right? That doesn't apply for adults. We're respecting their autonomy. So that dignity is very important in dealing with the adult aging population. But on the same coin, children deserve dignity and respect too, and nannies are great at that. Your interactions with the durable power opportunities will be a little bit different. A lot of times there's a lot of guilt around the elder companion picture. DPOAs who don't want to admit that mom needs help and they can't provide all of it. I would say that's a little more intense on the elder side. On the nanny side, think about it. Mom's a little bit ready to go to work. Maybe she has some guilt, but we're moving in a direction, right? That makes sense. Children need additional support. So I would say there's a little more guilt and a little more emotion around the aging situation, aging parents and next of kin. Nannies use these presence attunement skills of caring regularly. I believe this all translates. So where are we at right now? Are you thinking, all right, this is what I've heard from agencies over the past year. It's just not my thing, right? And a very prolific nanny agency owner I loved serving last year, I asked her, what's the number one quality you look for in caregivers when you're screening and you're trying to get your workforce built up? And she said the number one thing, and it's so simple, the elegance of the statement is the caregiver excited about kids? And you can see it. Like you could see it in their face. If you as the agency owner are not excited about elders, and I've heard this, it's like an immediate no, right? Like if you don't have some warm story about your Aunt Sally or your parent, or maybe you worked in a nursing home and you're like, gosh, I really enjoyed that time. If there's not some sort of light up for you and the caregivers you want to bring over into the companion side, it's pretty much an immediate no. Some people have said to me, only a couple, but it's very hard to get a full revenue stream based on a companion service alone. Don't expect this is in particular one agency expert who's tried it and who's done it for years. She's done some companion placements, but she's like, it's never been like this full revenue stream I could rely on. Now, times are changing. The population is growing, right? This is an agency owner who's done it for decades. So, but that is some of the pushback I hear. And then some people just say, you know what, I got into this to take care of kids and families and make these placements. It's not part of my roadmap. All fair. But the openness I've heard has been, I'd like an extra stream of income. I'm not 100% reliant on it. And I like the idea of helping elders. Or many of my systems are already in place. I just need to learn more about how this works on the other end of the spectrum. Or, we already know how to recruit. So tell me how to maybe try this out, take some steps towards it and try it in a low risk way. So I think, I'm not going to stop the slideshow, but I do have a little quiz. It's 15 questions and that can further get at, and I don't know if Danny, you can copy it or just type it or something and put it in the chat, but this can help you further kind of get to that yes, no, maybe space on the elder companion work. Now, I'm going to go ahead while Danny's doing that. I'm going to pause because I've just given you a lot of information and I'm happy to take questions. Are we crystal clear on what companion is and what it is not at this point? 22 minutes in. Danny, do you just let folks kind of shout out their questions?
Yeah, absolutely. I mean, I have a question, but I know we're kind of at the halfway point, so I don't want to, get to somewhere before maybe you get there anyways.
Oh, okay, good idea. So we'll keep going. So if there's nothing burning, I will just keep going. So these are sort of the pieces of feedback I've gotten from folks in your community already. And so this is my suggestion if you have an interest, right? Now, not everybody wants to do it this way. Of course, you know from the things I've tried, I am a startup person. I like to try new things. I like to see what's going to work. I make pivots. So I am favorable to the lean startup method, trying something end to end and seeing if it works, even if it's not the most perfectly polished product or process. However, I had one of my clients yesterday say, Sarah, I'm not launching this until all my forms are uploaded into Enginehire, which is really lovely that Enginehire can totally accommodate these intake forms that I've built. You can build them yourself. You can build them with your legal, but of course, like Enginehire's system is so expansive that you can certainly build these forms yourself and with using my content and put them in your system, right? So she said to me, Sarah, no, no, no. I am reading, every single document, the agency to caregiver agreement. And I agree with the same, but up and running before she even does a trial. Fair, totally fair. But think about it. All these steps you can do manually. I can give you the content, or you can find this content, you can generate this, and you can try an experimental placement. That's what I'm going to say. Now, maybe someone pushes back on it. So let's just go through that. Entertain me for a minute. What's the simplest, lowest barrier way I can actually test this end-to-end placement? Start with your audience. So you're going to warm up all the caregivers who have worked for you over these years. You're going to warm up all the families we talked about who have hired you to make placements for their kids. You're going to send an email to both groups. And the email is going to sound something like, I have had the pleasure of working with you, serving you for many years. I am considering elder companion work as a way I can further serve. I am testing my current market, and you are former clients, caregivers. I just want to know, have you ever had any interest in this kind of work, or do you have this need for your aging parents, aging friends in your community? Is this something that's on your radar? Is this a way I can serve you? And I have several of my clients do this. They hear back maybe from 5 or 10 people on each side, and they get a little bit of validation that, oh my goodness, there's a need. And they even start being able to identify, oh, this family here would be a really interesting fit with this caregiver here. So you start in your smallest concentric circle, right? Of course, I talk to clients who want to jump the gun and go straight to the gerontologist offices. No, tap your current audience, see if there's a way you can serve. You're going to get great feedback. See if you can jump on a call with them, both caregivers and potential clients, and just ask them what their problems and their needs are. Caregivers might tell you, I'm looking for more hours. I also like elders. I have experience here. Or I want to learn. I am all about the nanny who hasn't had a lot of elder care experience, but is interested and wants to learn. I really believe in that nanny. You may feel a different way about it. You may require experience with elders, you may not. So these are all okay things to get started. So I think once you get that sort of warm feedback, that'll be exciting. You'll say there might be something here. So you're not committing to opening up a whole new service arm and setting off the fireworks and setting off all the tech yet. You do want to make sure that you're covered insurance wise. So quick call, sometimes it's not quick, to your insurance, using the following phrase, and I should have just written it here, but the following phrase is for insurance to say, I would like to consider making elder companion referrals only, referrals in a non-medical, non-personal care capacity. So then that tells them they're not trying to be a home care agency. They want to make these warm referrals of companions who don't do hands-on care. And 9 times out of 10, what I've heard is there's not an additional fee. I think there was one agency that had to pay like 250 extra bucks a year to get this coverage. It's worth giving a call and finding out. And if you're going to make a first trial placement end to end, you got to have that. You know that. All right. Ensure your referral only, right? If you get into W-2 territory, then we're going to open up a can of worms about home care licensing, which we can talk about someday down the line, maybe, but start here, right? Refer your referral only, and you're clear, like I said, on any of those potential state regulations. Again, you're using the words, I'm a nanny agency considering making referral only companions placements, non-medical, non-personal care. Do I need home care licensing? And what we found is the answer tends to be no. Now, sometimes your health departments have to dig around a little bit. In Rhode Island, I had to work with a lawyer on it, and we finally got a letter. We finally got a response that said, no, you do not need home care licensing. It doesn't typically fall into that, but again, check state by state. It helps to use pre-made forms. So, you know, I know through legal, brilliant, do that. I personally have forms all set for my clients, and then they take them to their lawyers in their states and make sure that they work. And I'll give you a peek of those just so you can know what you'll need. So, and then you're ready, and you can actually maybe put together one of your previous clients with your previous caregivers. You can set it up however you want. I'll talk in a few slides. You can set it up like your babysitting service. Akash really liked that. You can use their occasional care booking tool for that. That is how one of my clients in the Northeast is going to do it, and charge a monthly fee. We can talk about that. Or you can do a one-time placement fee like you're doing your nanny agencies. So that is up to you. We can talk through both of those. The challenge is, how can we consider making this placement and getting this done end to end with our hard copy forms? What this will show you is the entire process. It will show you, oh my gosh, like this caregiver needed a little more training, that it's not a hands-on situation, right? And our intake forms take everybody through that and help you screen qualified clients and qualified caregivers. So anyone's welcome to take a screenshot of this or whatever, but these are those intake forms I talk about that helps you get, these good candidates for your first kind of matches, right? How do we screen the caregiver to make sure they're going to be a good fit and they know the boundaries of companion care as well? Of course, we give suggested work agreements. I can't give you an actual work agreement, but every single one of these forms were lawyer procured in the Northeast, which is a more regulated place. So you do have that going for you. And hopefully, it's not taking too long of your lawyer's time to make sure they're appropriate for your state, right? You want that, be able to hand off a sample work agreement, right? Because you're referral only. And then, after you've done your placement, the employer-employer relationship, whatever's going to happen is going to be between the client and the caregiver. Again, we're not going into W-2 how this works, but I'm sure there's some pathway somehow there. But I want to keep people out of licensing categories for companion care. And I'm sure most of you would agree. Not a lot of agencies want to go down the licensing route, but hey, I think that's interesting too, if that's what you're called to. Just some simple things. The emergency contact sheet, scope of services. Here's what the companion does and doesn't do. It's very clear for the clients. It's very clear for the companions. They're very clear on these factors all up front. So then it reduces friction later. You want to have that placement agreement between the agency and the client. So it's like you and the client, you want to talk about what you're placing for, what you're referring for. And I even have my lawyer come up with a scope evolution disclosure, right? Because this is going to be one of the pitfalls. Somebody really loves a companion. Oh my gosh, mom just needs help turning in bed. Oh, mom just needs help getting dressed. That scope, similar to the nanny world, can mushroom and grow quickly. And you do not want to be necessarily a part of it. You're going to advise your caregivers. I refer companions only. I do not refer for personal care. Now, if you're doing a one-time referral fee, you collect your fee, and something happens, scope evolution on the other end, and it might happen in a completely appropriate way. It might be this companion's like, oh my gosh, I love this work. I want to become a personal care assistant. I want to become a CNA. You have collected your referral fee and you're largely hands off. Now, if you're collecting monthly fees to access companion care, that could get trickier, right? Because you are only referring and you want your clients, the DPOAs, as well as the caregiver. And we optimize these forms for the elder client and then the DPOAs to both sign so that, you have these both sides. And it's always better to have a DPOA in the picture as a person to report to or, talk to, who's also helping manage the care of the aging person. So scope disclosures there, and then some marketing materials Those were not lawyer procured. Those are just some fun copy and design materials I have. But that's kind of your kit. That's everything you need for an end-to-end placement to try it A to Z, and then you'll see all the parts where you need to improve. Like I said, you can do the placement model that is a little less desired in the market because there is so much denial around mom's going to need this help for a year. A lot of people go into it thinking, mom needs help for a few months while I travel to Italy. Guess what? Mom loved that companion and wants that companion 8 hours a week for the next 6 months, the next year. Okay. So if we can kind of intro, this companion care, normalize it to the extent that we've normalized nanny care. I mean, I think it would be entirely beneficial to businesses aging in place and, reducing caregiver burden for children of aging parents. You can do the babysitting model. I talked about that. Again, it's easier sell because it's a little bit more like month by month, no problem. Most of the clients I'm consulting for are going to go the babysitting occasional care model. So we'll be kind of ironing out these issues as we get those up and running. Like I said many times, referral model avoids the triggering of the home health, research all your state requirements. I've said that a little too much at this point, but it can't be said enough, right? Consider elder companion as a complement to your current services in the beginning, right? Maybe it's not going to be the main source of income, right? It's something that you want to try in a small way, and then you can commit to perhaps as it, starts growing. We expect that it will. Marketing your services beyond that small circle can be at all these places I recommend here. And you can kind of use some of the similar pathways that you do, recruiting clients and caregivers already. You're just flipping it to the geriatric side. So common questions are you sure I don't have to be licensed home health to make these referrals? We know the answer to that. Got to check your state, but in a lot of cases, you're not. Where exactly is the line between companion care? I think I've drilled that home and medical care. And what are some unique considerations in working with elders? I think the unique consideration is that we have to treat elders we work with as autonomous adults, and that's a little bit different than when we're used to teaching and guiding and showing children the way, right? So that's a little bit of a different dynamic I noticed I had to get used to. I had to let the lady I was helping really lead the way and feel dignified in our work together. So those are just kind of some things and a vision to hold for you. And I will stop. And I think we have a little bit of time left. You likely don't have to become home care agency. We simply need to decide, is it exciting to you to help elders and help another generation and help a huge crisis that we're on the cusp of? If you can successfully match exceptional caregivers with children, you may already have what it takes to help older adults age with dignity. So feel free to take my email and stay in touch, and happy to take any questions.
Sarah, thank you so much for that. That was amazing. Super helpful. While everyone is gathering their questions, I wrote down so many, but the one that I thought was kind of maybe the biggest to me was, how do you so far have seen, like, because it's a very different market, um, people charge for this type of service?
Hmm. I would say there are some companion only agencies I've looked into, and I would say the charging is similar. It's similar to a nanny agency placement. It's similar to like the babysitting membership fees, and that is what the agencies are choosing for these placement is the similar fees. So I would say it's in the ballpark. Now, what the caregivers make, I think it tends to be overall actually a little bit higher. Maybe something like $4 to $8 an hour higher. Now, listen, this referral model where agencies are referring for occasional care, or referring for placements, is very different than what most of the aging industry uses. Most of the aging industry does use the home care model. They W-2 the staff, but what happens is with those caregivers, agencies will take 60% of the hourly rate. So agencies may charge like $60 an hour for companion care, but the companion might only see like $19 or $20 or something like that. something crazy. So in this model, what I love about this, and I think you like this with your nannies for those of you who do referral, is they're really able to make a more robust hourly rate if they're dealing directly with the client. So there's that factor too.
Amazing. Thank you. Does anyone else have any questions as much as Sarah was stressing everything about licensing and where the difference is, I want to stress that Sarah is here right now, ready to answer your questions about this. So does anybody else have any questions?
I do. Can you
Great.
hear
Go
me?
for it, Sarah. Yeah, we got
Okay.
you.
So I have been running a nanny referral service for the past 10 years, I guess, about. And I've done over the past 3 years, I've done a handful of companion care placements, just because similar to what you're mentioning, found that my workforce, a lot of the people have done elder care before. And then I had friends coming to me asking, my friend's looking for somebody for her mother, so it kind of happened very naturally.
Mhm.
And I was using the referral model very similar to what I do now with nannies. However, because of what you just explained, how the most agencies work, I was feeling like it was becoming exorbitant for the client. They were paying a referral fee, they were paying a higher hourly rate, right? Because what you were saying, the other agencies take a portion of that.
Mhm.
Plus, they were going to have to use my payroll service also, right? So it felt like, and they weren't getting certain things. They weren't getting the insurance through the home health care. They get insurance for the nanny or the elder care person, whereas I wasn't offering that.
Mm.
So it seemed like it was very expensive and they weren't getting the kind of benefit they needed. So how do you feel the referral model really works here?
Yeah, that's such a great question. I hear that a lot in the W-2 model. And, again, home care, healthcare is a tight margin industry, just like childcare. So, everybody has to be paid um, a living wage and what matches their education, experience, and market rate. And, including the home cares have to stay in business as well. So, one agency I'm working with is charging close to $200 a month for a membership to access companions. I think she may assign a few companions just to one elder client. That's another issue where children are a little more flexible with multiple babysitters, occasional caregivers. Elders are a little less, especially if there's touch of memory and trust issues, which we see in the older population. So I would say, we're also just kind of launching this with our first couple placements, and to see it again as an additional stream of revenue where the referral fee is reasonable. But then think about it, the client, and there was a question in the chat, the client uh, pays the caregiver directly. So when a client pays the caregiver directly, they don't have to pay the caregiver $60 an hour like they would pay an agency. They would pay the caregiver, like they're 30 an hour, right? And so instead of paying the 60 to the agency, they could see it in a way as like I'm paying 30 to the caregiver or 25, 30, maybe 35, right? And then I pay like a finder's fee every month. Okay. So instead of or I pay a one-time placement fee. So it's either you can position it as like, look, we don't take, money from the hourly rate of the caregiver. If you're going to do the referral model, the caregivers make a healthy living wage. And we take a referral fee that would absorb what normally is spent in home health fees, hourly fees that really take a good chunk of the caregiver's hourly rate. I mean, I think that's one way to explain it. Is
Mhm.
that helpful to you? Are you still seeing like the tight margins and it's just still hard?
Um, I see that. I guess it requires some education maybe to the client or explaining it and maybe working a little bit with the hourly rates and the referral fee itself to
Yeah,
make
that's
it
right.
more
Hmm.
worthwhile for people. I don't
Yeah.
think I know what that is yet. I've been trying to feel that out, and I've gotten a lot of pushback. For some people, it's been fine. Maybe it's
Okay, good
finding
to
the
know.
right, yeah,
Yep.
maybe it's about finding the right segment of the population. That's very possible.
Yes.
But I've gotten a lot of pushback too, where they say, well, I could just go to home health care and everything will be, it's just, especially for when you're talking to a lot of these adult children, they don't
Yes.
have the bandwidth to deal with it. They just want to go to a place like an agency where it's just going to be taken care of for them. It's almost less bandwidth than the parent,
Mm-hmm.
right?
Well,
Than
that's good.
a
Yeah.
parent with kids, right? It's like I have kids of my own. I have a full-time job. I'm trying to take care of my parents. I just want somebody to completely handle it for me.
Yeah. And I do
Whereas in
think
this
that's, yeah.
model with the referral fee, you're not fully handling it for them, right? They're still
Mhm.
doing a lot of the admin on their own.
Yeah. They're going to have to work with like Poppins or HomePay or, one of
Right.
the
Right.
payroll companies. They are going to have to do that in the referral. But I would say yes, in that sort of luxury market, you will have a few more buyers there. So this is like location dependent to where you're located
Mhm.
in the country and the kind of in the kind of needs and region, right, that you're in. Um, like when I was a companion, I made $80 an hour. It was amazing. Like I funded my startup that year with my companion care. And it was just, it was the luxury market. So, that's not to say, I'm looking at like the PACE program in Massachusetts, right, where they help Medicare and Medicaid elders age in place as well. We're looking for tools and resources to help them too. So, but I do think, much like nanny care, your luxury market is the market to be able to reasonably afford this and manage this.
Right. Okay. Great. Thank you very much.
Mhm.
Sarah, do you have anybody, this is Marilyn, do you have anybody who's asking if you can if they can use some of their Medicare benefits or if they can, use whatever grants or whatever that they have to help pay for your services?
Yeah. So Papa Pails, which is a huge startup placing elder companions that I quoted in my grant application, has found a way to utilize Medicare, Medicaid benefits to pay for companions. Good question. Danny was thinking about that too. So we could look a little further into that. What I do know about Papa Pails is, and this is why I really talked about the nanny agencies, is that they had some early lawsuits that were really um, disturbing. They really weren't screening and vetting. If you're going to pay caregivers low wages and, really focus on volume in the care space right out the gate, you're going to have some of these issues. And so, with your model, a lot of, this kind of like boutique luxury care model, I think that puts you in a position to, you know, find your early clients who can, and they might be private care clients, who can reasonably pay for this kind of service. You're trying, it out, you're, watching every move, you're doing that sort of like trial. And then I think like later you could look into that. But I mean, all I know is like being a Medicare, Medicaid vendor is very complex.
I don't want
um,
to dip my toe in the water.
what's that?
I do not even want to dip my toe in that water.
Right? It's very complex. Yeah.
No.
Yeah.
Okay, thank you.
Yeah, sure. Okay, so where are you guys at? Danny, what were the responses like? No, I'm not going to do this. Maybe I'll do it. I'm already doing it. Anybody already doing it out there? I know Sarah mentioned, I think she was sort of experimenting with it and hearing the need. I know, Marilyn, you've considered it, and I dropped off the planet for a few weeks in the world this year. I had a really awful health issue in my immediate family, so I apologize for that. But I'm back at it.
I hope
50-50 is what I
I
saw.
hope that that's resolved now. Is that better?
We're better. We're better as a family. Thank you.
I'm glad to hear that.
Yeah. So, sure, happy to have any follow-up discussions. I will consider becoming players in this. It's definitely been another one of my worthy experiments this year. I think next year, nanny agencies can still access anything I've built through the grant. But we're also going to find a way to use some of the material we've developed for elder companion care to help home health agencies, to help other organizations as well. Because I'll tell you what, and Enginehire knows this, they figured that out. Tech is in its infancy, and like, elder developmentally appropriate resources in one spot, programs that are innovative and future oriented, they actually are lacking in the aging space. So there's a lot of opportunity there. And yeah, I appreciate everyone's time. And Danny, just the eternal optimist, and always makes you feel like $1,000,000 no matter what. So appreciate everything, and Enginehire, and
Oh.
really lovely for Akash to reach out to me too. We were sort of like competitors last year, but like, how collegial is that, right? I really appreciate Akash reaching out and just saying, hey, tell me what's going on with your elder care. I'm in this space. I think it's something that could benefit agencies. So very cool.
I had
Yeah,
a quick question.
Yeah.
perfect.
Sorry, I'm Elizabeth. I'm located in Atlanta. I'm starting out. I just opened back in January doing nanny placement, and I have my babysitting side. But one of the biggest things that I want to do is get into elderly care. One, I know it is a big thing. I've seen it for my 20 years as a nanny with families I've worked with. And I kind of want to base my elderly side, the elderly companion side, kind of like how I have my nanny placement, where families come to me, they pay a flat fee to find a caregiver for their elderly parents, whether it's full-time or part-time. And then I do all of the sourcing for them. So I am hands-on to the point where I'm going and setting up every interview, trial. I'm there with offers, the employment agreements. I stay in contact the whole time, so they're not felt alone, but not wanting to do the W-2 part.
Yes.
And I know in the beginning of this conversation, you talked about W-2s. Like, I don't want to have to do that on my side. I let that be something that the families and caregivers talk about. But also adding in elderly sits, is that something feasible to do? Or would that make sense if I opened up an elderly side to my business?
I'm sorry, I didn't hear your last word. To adding in an
Oh,
elderly.
like, so adding in like a sitter side to the elderly, for elderly companions, where a family who they just need a break, but they don't need somebody there every single day.
You
They just
could.
need,
Yeah.
okay.
Yeah.
Okay.
And I like, after developing babysitter occasional care software, like, I know nanny agencies want to
Hmm.
make their fees in like 10,000 different ways, right? Like, some want to
Yeah.
just charge a monthly fee. Some want to like charge per visit, right? You want to have
Hmm.
all your specialized packages. And I would say what keeps it easy is almost like mimicking it, like what you're doing on your sitter side. So it's like,
Hmm.
whatever you found is working for you on the sitter side, like, try it out, roll it out when you start doing kind of the first elder companion. Yeah, and what you're describing is the referral model. So yes, you can refer, similar to how you refer for your occasional caregivers or babysitters. You can certainly refer these companions, and of course then you're passing on all this information, right? If you go past the IRS threshold, $2,800 or whatever it is, or this is taxable income, all that wordage, that's in all of my boilerplate forms, and I'm sure it's in all your
Hmm.
agreements and contracts and things like that too. As long as you pass on that information and both sides are agreeing to it, you can, certainly be in that referral lane.
Okay.
And like I said, this is a new model, which is kind of exciting because folks are just used to home care and the issue of quality. I hear over and over, like, these caregivers, they're like not high quality, and there's all this churn, or they fall asleep on the job and all this stuff. And it's like, well, you're paying them $17 an hour,
Exactly.
and yes. And now that you have to pay caregivers well to attract talent and quality and be able to refer that. So
No, I agree, because I actually had a candidate come to me that works for an agency, and she's like, I make $17 an hour and I'm doing all the work and I'm tired. And that was one of my biggest things when I started Little Bird was I I don't, yes, families come to me and they pay a lump sum for me to help them find a nanny, but when it comes to the caregiver giving the care, I don't take money from them because that's their money that they're making. So I wanted to see if that could move over into the elderly care part of it.
Yeah, that's exactly the model I've been working with now. This isn't
Okay.
to say that like doing the W-2 or taking, some portion of the hourly rate is a bad way to go. I know a lot of nanny agency owners who do go the W-2 route, like Carson
Mhm.
is coming to mind. They do it ethically and reasonably, right? And it's not this like gouging situation. So
Mhm.
there may be a place for that somewhere. It's just in my research of being able to refer companions. If the companion is a W-2, it's somehow, especially in the state of California, that's the big one there, the if a companion is W-2, you are immediately like put into you need to get home care licensure
Mhm.
category and then keep that licensure up, and that's very expensive, and then that's more liability, more responsibility. So if you stay out of the W-2, you'll likely steer clear in your state of home health licensure, but definitely check that. It's not always crystal clear. So what happens
Okay.
is it's like kind of a no man's land. And sorry, I talk a lot about this because it's sort of like health policy, and
No, I love it.
but yeah, it's a no man's land to be a referral agency for non-medical, non-hands-on companions.
Yeah.
It's like not a lot of people are doing it. Like my lawyer in Rhode Island, where I live, we saw a companion agency just crop up out of nowhere. Okay, we place these companions. This is what we do. We have no idea what the employment structure is. Are they W-2ing? What are they doing? 1099ing, right? I don't even go with the 1099 talk with companions, but it's probably something that's viable. I don't know. I still
Mhm.
kind of go the nanny, like they're W-2'd, like babysitters. I just sort of stay that route. I think it's
Mhm.
safest and best. So that's what you should recommend in all your forms moving forward. But all this to say, my lawyer and I were like, are they even legal? We don't even know. Like, we haven't answered this question. Like,
Yeah.
so, you do have to do a little digging with your health department just to make sure like referral is something you can do with companions in your
Okay.
state. Mhm.
Awesome. Thank you so much.
Sure. Thanks. We almost made it the whole hour, Danny.
Yeah. I just tossed in again your assessment and where people can learn a little bit more about you. But is there any other places that anyone should go to learn more and connect with you?
Sure. I will just put in my little Lily Companion program.
Hey, will there be a recording shared for this meeting?
Yes, absolutely. So we will, I will put this recording up. I will send it out as soon as possible. And then you can always find any Enginehire webinar recordings on enginehire.io. There's like a tab at the top that says about webinars, and you'll find all of the recordings there. But yeah, so great question.
Thank you.
So
Yeah.
nice to see many of you. Hope to see you around.
Well, Sarah, thanks again. Really appreciate this. This was so wonderful, and I think that there's clearly a lot of questions around this, and I think that that's really exciting and telling about all of this. So,
Cool.
Sarah, thank you so much, and everyone have a great rest of your day.
Thanks, everyone.